Do you have a favorite between Bill and I?
Do I have to pick one? Both? Neither?
Pick one.
It has to be me.
Also depends on the day.
Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Gaurav Bharti. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
All right, hello everybody. I'm Gaurav Bharti,
Bill Kortesis.
and we're really excited today about our discussion with our incredibly talented partner, Dr. Shawna Kleban. Today we're going to talk about massive weight loss and massive weight loss surgery. And Dr. Kleban is an absolute world's expert on this. She does incredible cases. I'm always in awe at her results, and we're going to have a nice discussion today.
Yeah, super excited to have you on the show and to talk about one of your passions. I know you love this procedure and love taking care of patients.
Yeah, thanks for having me. And I'm honored to be here to be able to talk about what I love and the patients that I love to take care of.
You know, when people start contemplating this, and they come and see you, explain to the audience kind of what is it like? Like what's the process? When do they come see you? And how do you decide what to do?
So that can be pretty complex. Patients will come at many different times during their journey. Some will come during their weight loss while they're actively losing weight, and just to get an idea of what might be out there for them. Other patients come once they've lost the weight, feel stable, and all of that, but we won't do surgery until they are kind of at that plateau, stable at their weight and feeling good. The process is pretty in-depth. So oftentimes these patients have multiple areas that are affected by the weight loss. And so we're talking head to toe rejuvenation. Mm-hmm. And so it's a step-by-step process. I kind of ask them what they're interested in talking about, and then mention some other areas that they may not even know are possibilities that can be improved with surgery.
What is like massive weight loss? Like how much weight are we talking about?
Well, it depends on where you're starting from, first of all. Mm-hmm. So I have patients that have lost anywhere from, say, 60, 75 pounds, which that's a significant amount of weight, to up to 200 pounds. My patient today lost 140 pounds, and we were doing her second stage surgery, and really excited for her to see her results after that.
I think you bring up a really good point, right? It's not necessarily the amount that you lose, but it's more the percentage that you lose from where you start with. Because it's ultimately what we're taking care of is skin laxity, right? And like everybody ends up having skin laxity everywhere, from their face to their body, all parts of their body. So how do you, when you talk to somebody, how do you talk to them about, is it going to be one surgery to tackle it all? Are we going to do multiple surgeries? Or, what's your approach?
Shawna, you were alluding to it, like it affects everything. And so when someone has that kind of weight loss, like it can affect like literally every part of their body. Arms, tummy, chest, back, butt, legs, face. And so you can't do all those things at the same time.
No.
Now, I will say that we're able to do some pretty incredible combos, and I'd love to kind of hear about like your all's favorite combos for massive weight loss surgery. But I think staging is totally appropriate. Sometimes people have, I don't know about you all, but I've done like, I'd love to hear everybody's. I've done a couple where I've done like 3 or 4 stages.
Oh,
and
all
like,
the time.
Nothing wrong with that. But we're doing a lot of stuff each time, right?
Yes.
We've done some things together. What do you do when someone wants to really try to tackle everything at once and it's doable? Like, how's been your approach on those cases?
So most of my patients, I sort of start with what's the most important to you, because getting that tackled first really gives them this boost of kind of energy and confidence that then makes them excited for those next stages. But if we're talking about how to pack in as much life-changing surgery at one time, really starting with the trunk is kind of where we want to start because that tends to be the procedure that takes the longest. And then adding on other areas, whatever their priorities are, maybe it's the arms, maybe it's the breasts, maybe it's the thighs, it just depends on the patient.
One of the foundation pieces of this organization, HKB, one of the reasons why you did the fellowship and we all got to work with Joe Hunstead is that we've always been taking care of massive weight loss patients. It's like one of the crown jewels of our organization. And I think it's important because a lot of surgeons now are all just kind of latching onto it, just doing this, and they don't have experience. What's the unique thing is about a massive weight loss body contouring, and what are some of those nuances that we do differently and we handle appropriately compared to like just a mommy makeover, for example?
I think with these patients that have lost a large percentage of their body weight, there's skin everywhere. And so trying to figure out where to place your incisions, where they're going to end up when you do these procedures, that takes time to understand that and seeing a lot of these patients over and over again to find that perfect incision placement, to get the patients the results that they're looking for, getting them tight enough without having wound breakdown issues and those sorts of things. That's higher level stuff that when you aren't doing these procedures very often, you may leave patients with a lot more skin laxity because you're not used to how tight are you really able to pull these patients, and where is that incision going to end up. And some of the things that you see is if you're not experienced, maybe the incision's in a place that the patient doesn't want. Maybe it's writing too high, writing too low. The vertical incision is off to one side. So it's really those little nuances that take time and persistence and care to get right.
I mean, even doing incisions with opposing forces, right? When you do a broad line back lift, which is actually a removal of that skin in the upper part of the back, and doing a 360 tummy tuck at the same time, which we all do very frequently. Again, you're actually opposing kind of tension lines and forces in those cases. And again, knowing the nuances of how much skin you can actually remove in those areas. Or if you're doing a buttocks lift and a vertical thigh lift at the same time, you're actually, moving thigh skin whenever you do that. So there are complete nuances. I think one of the things that sets us apart is the fact that we treat both massive weight loss and regular body contouring patients the same, and we look at the 360 evaluation. I mean, I think we're one of the first, if not the first in the entire country, to make sure that when we take care of patients, we're looking at the 360 part. Where, a lot of places out there just end up doing two-dimensional body contouring. You can't do that. We're not two-dimensional individuals, right? So you have to take care of the whole area. So when you take care of the trunk, the anterior part, the front part of the abdomen, you need to look at the back part, right? Take care of the buttocks, the lower part of the back. That is all part of ultimately what we do.
I do say that all the time. The waist is a 360-degree structure.
Right.
And so when you neglect the back, sometimes you're missing a big piece of creating that shape that the patients are looking for.
Both of you have recently changed kind of your approach to tummy tucks, which I'd love to kind of touch on, but you both have kind of gone more to the extended tummy tuck. Can you talk a little bit about that and why you've kind of moved towards that approach?
Yeah.
I think that because I'm doing more 360-degree care as far as addressing the trunk, there's some laxity that extends beyond that hip in a lot of patients, and seeing more patients on GLP-1s, they may not be treated by just a standard tummy tuck. And instead of chasing, say, a dog ear, which is a little bit of skin at the end of an incision, we can have that incision lay nice and flat and create a larger result on those patients, and maybe get even a little bit of lift of the outer thigh sometimes, depending on how far around we go.
Yeah, it's a simple concept too that, even the most layman can understand once you really make it simple, is that when you take something that's circular and you make it linear, there's bunching on the ends. And then you have this fixed structure called your ASIS, which is your bone, your pelvis. And so when we do these type of contourings, if you just extend it further and go posteriorly, the results are just, the reason why I was starting to do more and more is like the results just look so much better. The negative, here's honestly, this is a longer scar. And I don't know about you all, I hate scars. I really hate them. I hate them I hate them so bad, and I can't wait until we're going to be able to do surgery without scars. But right now, it's not here. But the contour and the result that you get is dramatic. And then doing circumferential like resections. I will tell you that I'm doing more and more kind of lower BMI, which means less of the overweight patient. So it's not like your prototypical patient, like, oh, they need a body lift, where you're doing circumferential abdominoplasties. And man, they look insane. They look great, and like patients are really happy afterwards. Now they are okay with the scar burden, but it's like they just don't want to. They don't want to sit here and have laxity. So I think we're better at asking our patients directly, "Hey, does this bother you? Because if it does, we can get rid of it. The negative, longer scar." So I think that it's interesting that we're doing more bigger procedures, but we're getting better results.
Isn't that amazing? When you take care of the back, the front looks better.
Oh, yes.
Always.
Always, it's crazy. You know, the other thing too is like, you know, how often do you guys use? So obviously with massive weight loss, you do, you know, excisional procedures. How often though, like you're a huge champion of this, and so are you. I mean, you guys are both similar in this, and that you always are using lipocontouring as part of what you're doing. Talk to us a little bit about your philosophy on liposuctioning with massive weight loss skin resections, and then also using potentially energy platforms. Like, do you think it's worth it, or do you just avoid that on those patients?
With these patients, what you see first is a lot of skin, right? So that's what you see first. But oftentimes there's some pockets of fat surrounding that skin. So once you remove the skin to create the shapes that you're looking for, those nice silhouettes, doing some liposuction really helps with that. So the bulk of the procedure is actually the skin removal in these patients. But then the fine tuning, that finesse is a little bit of liposuction. And then as far as kind of the energy-based technologies, I usually reserve those for, you know, residual laxity after the fact. We pull you really nice and tight. I don't see as much or as strong of a result in some of the massive weight loss patients with some of those energy devices than my patients that kind of have better skin quality and those sorts of things. So I think for those patients, skin removal first, and then using the energy kind of as a backup, you know, secondary stage if they've got a little bit of laxity that we need to treat.
What is your all's thought? You have a massive weight loss patient that's kind of midway, but they just have a lot of skin, and they just want to get this process started. And then if they say, well, what happened? Can I lose more weight? How do you approach that patient?
That happens kind of all the time. I have a subset of patients that are kind of plateaued. They can't work out of the gym. The skin's getting in the way. It's just affecting their quality of life. And although they're not where they want to be weight-wise, the skin's impacting them so much that it makes sense to do surgery at that point. And with those patients, I do counsel them before, letting them know, hey, if you lose more weight, when you get to your goal weight, you may have a little bit more laxity. Maybe we touch up a little bit of things. But this may help you get to that point because you're able to actually do the exercises you want to do, actually move the way you want to move, and do the things you want to do. And it kind of gives them that confidence boost, too, of getting their a little reward halfway, so to speak.
You know, all of us get to take care of amazing patients, and you know, working can be hard, but there's cases you do that just warm you and just kind of change you and make you want to do more. Is there a case or two for a massive weight loss patient that you could tell us about, kind of what you did and why it was special?
I mean, it's so hard to pick one because every story that I hear from these patients are life-changing for me. Every patient has something that these surgeries have changed the way that they interact in the world. So I'll give you an example from today. So my patient today, second stage surgery with me, and she said, you know, before I lost the weight, I wouldn't even go on an airplane. I felt embarrassed to walk down the aisle on an airplane. And now that I've lost 140 pounds and now that I have this skin removal, I want to go out and explore the world. And so just even something simple as being able to be on an airplane is something that you don't think about so much. And so it's great to be a part of that journey. I always tell them, you did the work. I'm just the cheerleader at the end, you know, waving my pom-poms and helping you see all the work that you did.
Yeah.
These procedures are astonishing what they do for individuals. I mean, I think that they're by far one of our most rewarding procedures we do is take care of the massive weight loss patients. I mean, they're over the moon ecstatic. You know, one of the common questions I get asked is it safe? How many procedures can I do? Because they want to knock out a bunch in one particular time. and kind of walk us through, a patient's coming in, they're like, doc, I want to get all this done. Can I do it safely? How much is feasible? Is there a length of time in surgery that is the mitigating risk factor here, or is there something else? Or is it the amount of tissue you remove? How do you walk through the patient in regards to kind of their safety concerns and how much can be done?
Sure. So when a patient comes in, there tends to be a laundry list of items. And so how do we categorize that in the safest way possible? How do we break up those stages? And like I said before, I'll try to start with what they want the most and then add things on as I can, keeping things around 6.5 hours worth of surgery to keep them safe, keep them warm. That's our number one priority, is safety. Number two, obviously, is our aesthetic result, but number one is safety. Then it's also about, how much can you take off at one time? Taking more than 10% of somebody's body weight starts to become unsafe. And then also the patient's age comes into consideration as well, not just their age, but their kind of physical age, how they interact. Are they the type that's in the gym all the time, or are they more sedentary? You can do a little bit more surgery on somebody that's starting off healthier, starting off already going to the gym. They bounce back so much quicker, and you have to be a little bit more cautious in, say, older patients or patients that are a little bit more sedentary.
So let's dive into that a little bit more. I mean, sure. Would you do, if you're doing the trunk, would you add that trunk component with an extremity or breast or face? Or what are the typical combinations that you would do together?
So I'd say my most common combinations are trunk and breast, and the trunk can be just the front and some liposuction to the back, or an incision that goes all the way around, or an incision that goes all the way around and up and down. So there's a lot of different combinations for just the trunk. Then usually something with the breast that can be either a reduction, a lift with an augmentation. Different options there, lift with mesh. There's all sorts of different things that we can do. And then typically I'll do a second stage with all 4 extremities, which patients actually do really well with. You would think that it would be very difficult to move around if you have your arms and your legs done, but patients do great. And so arms and legs can be done at the same time, and then sometimes an upper back lift. Some patients don't need that, though. It just depends. And then usually the face is separate just because it takes a little bit longer, or it can be a combo case that we do together, potentially.
The big thing is what it's amazing what she's saying, and it just goes back to kind of, critical principles in kind of how you approach, the aesthetic patient or any patient in general, is that they're unique. They have different, issues. They have different physical limitations, and so, selecting what's going to work for that situation is going to be unique to that situation, and we kind of conform to that. And I think the amazing thing, though, is the ability to do larger procedures. We'll get comments sometimes, and sometimes you might even get some hate comments through other people in the space or other offices via other people, like saying, "Oh, those guys, they do too much at one time," and there's other people doing it. It's like the truth is that it's methodical. Like we when you have somebody in the operating room, like you got to keep them warm, you got to avoid any blood loss. You have to, keep them off of anesthesia. You basically want to do it, be very efficient, but you also want to do a really great surgery. Mm-hmm. And so, there's it's like this well orchestrated, symphony that when we're in there. And so, all of us are such micromanagers in there, but it's fun to see how other people do stuff, and then see some of the other results, and where where to push, when to let go. Mm-hmm. And that's a hard thing I would say in aesthetic surgery. That's one of the hardest things to I've ever seen, and working with a lot of people. We have a lot of people on our teams. Some people get it and some people don't. You get it. You know how to teach it, and that's not something that you can just any plastic surgeon can get, because there's this aesthetic concept of what's beautiful. And we didn't even talk about Shawna's a damn artist. She can draw fucking anything. We'll have to hear about that. But I think that goes into one of the reasons why you're such a great sculptor, in some ways. Because there's understanding the vision, but then being able to execute on that. And we've worked, Bill, we've seen it all. And we were talking about the incisions. Guys, I've seen the craziest incisions. One of you all did the case. I think Joe Hunts had seen this patient where there was just incisions that didn't make any sense. It's like you get this massive weight loss and you're making incisions in places that make no sense. Because ideally, patients should go to the beach in a bikini. You don't see their incisions, right? Mm-hmm. So I don't know. It's really surprising, and I can't help but compliment her and your results and just the way you approach patients, because it's not easy.
But you bring up a really valid point. I mean, we often get patients that have seen a couple other surgeons, been to a couple other consultations, and they're like, hey, I can only do your circumferential tummy tuck and that's it. Or, that's going to take me 6 hours. How do y'all do it faster? Well, I think a lot of it is, the 10,000 hour rule applies. I mean, we've done a lot of them. I mean, when I mean a lot, we've done a lot, and we know how to be efficient and safe at the same time, right? And still get exceptional results. And because of that, we can end up doing 1 or 2 more procedures, all within that 6 hour, 6.5 hour time frame. I agree with you. I think, you kind of cap it off around that time frame, because one of the understated things you mentioned, which is very true, and we talk to our fellows about this all the time, is like blood loss and warmth, right? If you can limit blood loss in the patient and you keep them warm, and you do this in a very efficient manner, patients do extremely well postoperatively.
It's sometimes amazing when you think of all the work that you've done in that, say, 6.5 hours, and the incisions that you've placed on this person's body, and then that night they're up walking around. So we keep a lot of these patients overnight at our facility, which is great, and they love it. And our nurses get them up, they're walking around, moving around. And some patients, come in to this, or people out in the world would think, there is no way that I could get up and move around. And they do, 100% of the time.
You raise a really good point too, and it's something that's interesting to explain to people too. Like, incisions typically, when closed and performed appropriately, and we deal a lot with skin. Like, at the end of the day, we're dealing with skin and soft tissue. That's usually not super painful. Now, when we tighten muscles, that can hurt, but how do you handle preventing muscle tightening pain?
So I help prevent that pain by doing a block. So I do an ultrasound-guided block of the rectus muscles with something called Exparel. And Exparel is kind of a long-acting numbing medication to help with the pain and discomfort in the abdominal region after something like a tummy tuck.
So I think you're right. And so at the end of the day, like, people, even after a big body counter, like, you get someone who does like an arm lift, brachioplasty, like, they don't really have much pain, versus someone who's had like a lap chole, or someone who's had a GI surgery, where you actually have divided muscle or had to like distend the create a pneumoperitoneum. They have real pain. Most of our stuff doesn't actually have that much pain.
No.
I mean, how about like
liposuction can hurt a little bit.
Yes, I was going to say, don't forget about liposuction.
Lipo can be really
that hurts.
Excision of skin and fat, less painful. Whenever you do liposuction, it can be painful. I mean, it's tough recovery. I don't want to sugarcoat it on patients, but liposuction can be tough. But it is. I think whenever we talked about it, we touched on it. I think it's almost mandatory on all our body contouring to do some version of liposuction, because they need us.
But it's interesting. The lipo thing is, it's people say, well, why does it hurt? Well, remember, it's like if you're treating like the trunk, and you're like doing liposuction, you're like extracting little bits of fat, you're going all the way around. It's a huge surface area. That's the thing, is you don't see it. And it's just like, the surface area is massive.
Kind of messes with their minds too. They have these tiny incisions, and they're like, oh, I hurt everywhere.
Yeah.
And all those nerves are getting banged up, bruised up, and
now we're doing energy. We do ultrasonic energy, and you do Renuvion and things like that. So you're causing a tremendous amount of trauma. I mean, this is an interesting thing that we can talk about, but it's amazing what we do as surgeons, and like, I'd love to hear you guys comment on this. What we're doing is we're just basically we're traumatizing the patient. We're hurting the patient purposefully to allow their wound healing cascade to then take over and do the rest.
Well, there is a lot of that in regenerative medicine in general. I mean, if you think about what a CO2 laser is, if you think about what microneedling is, I mean, a CO2 laser is creating a controlled burn of the face to allow our body to heal and create collagen. And then microneedling, sticking needles in your face to cause collagen deposition. So there is a lot of that in what we do, for sure.
What are some of the nuances or challenges you face in breast surgery in the massive weight loss patient? Because these are not easy cases.
No, and those patients, we will see oftentimes the breast is sitting in a place where we don't want it. It's sitting way down on the ribcage, almost on the abdomen. And so how do we get that breast back up onto the chest? How do we restore volume? How do we create the correct nipple placement? And sometimes it's, we're doing a single stage surgery with plan for revision for some skin excess, because a lot of times on table everything looks perfect, and then that skin quality is so impaired from weight gain and weight loss that things just drop pretty rapidly sometimes in these patients because of that poor skin quality.
So I think you bring up a really good point. I think having that conversation with patients ahead of time, that there's a good chance we're going to have to revise your breast lift because your tissues just won't hold. Even if we use mesh, it still may do that.
Yeah.
What's on the horizon for our area in dealing with skin excess?
It's so hard to say because we've been doing skin excision with big incisions for such a long time. These non-invasive or minimally invasive devices provide some result, but we haven't found anything yet that I think provides us with the same amount of change that incisional surgery can. And so if we find that, then that's going to be obviously the new horizon. If we can find a way to get that skin to shrink down, that would be great. But then there's also the other side of how do we prevent the skin from ending up like that way in the first place? So are there things that patients can be doing during their weight loss? Are we going to learn that there are certain peptides out there that when used in conjunction with weight loss may help prevent, some of the thinning of the skin that we see? I don't know. I really don't know.
What I can safely tell you is we're going to see a lot more of this. GLP-1s are here to stay. More and more individuals are getting on it. We're going to see way more weight loss patients. And so I'd encourage every, patient to really analyze where they go, what they do, who they allow to do surgery on them to take care of it. There's going to be a lot of patients, and everybody's going to be saying they can do this. But to your point earlier, there's nuances with these surgeries and techniques, and you really want to go to somebody who does a lot of these. And Dr. Kleban, you are one of the best, if not the best in the country doing
thanks.
it. So you're
Thanks.
excited to have you part of the practice and here and partners with us
It's
in
been
this journey.
a good 6 years so far. Can you believe that?
Oh, we're all just getting started.
I know. So just like the weight loss, the skin removal surgery process can be a long process. So each surgery has about a 6-week recovery, of intense recovery, out of the gym, not living life to your fullest, so to speak. And then staging surgeries at least 3 months apart, but a lot of patients do longer because they're in recovery for 6 full weeks. They're not ready to jump back in so quickly. And it's a lot. It's a big surgery. We're removing a lot of skin, but the smiles on their faces when they come back in it's amazing. Once they get through that recovery, I don't think I've had a single one say it's not worth it.
Yeah, one thing I would say, though, about staging, too, and why I love staging, and we all love staging, and we all do it. You do it. I know it for a fact. It's because we care about our results also. You're not doing real massive weight loss surgery if you're not adjusting and improving your results. Every massive weight loss patient usually has something you need to tweak. It's just the way it works, and a good surgeon always points that out and always says, I see this. When we do your next stage, we're going to tighten this up. We do it all the time because, number one, it's just a better result. And I think that it's really important to know that, that's the deal with mass weight loss skin removal surgeries, that it is a multiple procedures, and it's at the patient's time. It could take 6 months, it could take 5 years, depending on what's going on, because everybody has shit going on. Everybody's busy. Imagine if you had to have 3 surgeries in a year. There's just no way. And so when these patients do it and they are functional, some of them are big time professionals doing all this stuff, and they're jacked and shredded, and they have kids. I don't know how people do this stuff.
It's impressive.
It's remarkable, to be honest.
But it's just doing the right thing for the patient.
Yeah.
That's it, and take care of them. Treat them like you'd want to be treated, and that's kind of what we do.
Yeah, and I use this analogy a lot with my patients. Because I'm a woman, I can use this analogy, is that I feel like massive weight loss skin removal surgery is almost like doing a wedding dress fitting. So if anybody has been married or even heard of someone that's been married or has a friend that's married, that you get your first fitting and they do something, they tweak a little bit, they get things mostly right. That's the big one. Then you go in for a second fitting. And then somehow there's a third and the fourth. There's always little tweaks to get things perfect. But if you get a pair of pants tailored, you're only going in one time. But for something as big as a wedding dress, you're going in multiple times to get it just right. And so I kind of give them that example, and it's kind of a nice way to think about things. It just kind of puts it into context of real life.
I love that.
So if we're redoing the entire surgery, then yes. If we're doing a small little skin excision, sometimes they don't even have to go to sleep for that. We can just numb it up in the office. Takes 10, 15, 20 minutes, remove a little bit of skin, and they're on their way back to work. But still not soaking the incision, so no pools and that kind of thing, but really much easier downtime for little tweaks.
Do you have a favorite procedure in the massive weight loss patient?
I think it changes patient to patient, day to day. It's whatever gives the biggest result. So whatever that patient has, wherever their skin is the most fat that they have, the biggest result that I can get, that's my favorite. And so if a patient comes in and all of their laxity is in their trunk, then I'm going to love doing their tummy tuck. If it's all in their thighs, I'm going to love doing their thigh lift because it's just going to be life-changing for them.
Do you have a favorite between Bill and I?
Do I have to pick one? Both? Neither?
Pick one.
It has to be me.
Also depends on the day.
Is there a pet peeve when it comes to these patients in regards to, is there a specific, I can tell you, mine per se, but I'd love to hear if there's something that listeners and people who are watching our podcast are seeing that they're like, hey, don't go in and ask your surgeon that.
I think it's having realistic expectations about what your body has been through, not just what your body looks like that day and what we can achieve, but what it's been through and how that skin's going to respond. Because the massive weight loss patient, their body doesn't respond the same way as someone that hasn't lost that amount of weight. And so you just have to realize that it's going to be a little bit different. They're going to have a little bit more skin laxity. Even no matter how tight I pull them, they're always going to relax a little bit more than your average patient.
I think my difficult one, I'd love to hear yours, G, is when somebody wants a lot of skin removed through a small incision.
Oh, well, yeah. I don't even talk about that.
And it happens all the time with the arm lift, right? Everybody's like, hey, I want all this gone, but can you just do a small incision in the armpit? And I'm like, there's no way.
And I want patients to know, I've tried them all. It does not work.
I mean, and again, the way I answer that is like, the more incisions you have, the more I can remove. That's just the way it is.
And it's just, small surgery, small results. Big surgery, bigger results.
Do you have any, G?
My pet peeve is doc, the biggest thing for me is going to be how much this costs. And I just for me, when patients do this, it's like, listen, you need to focus on what you want to get, how you're going to get it, do your research on who's going to give it to you. And I would not be trying to find a bargain surgeon. I would not be trying to find the lowest price thing. I mean, that just baffles me. And when patients try to introduce that into the room with me, and I don't want to have to worry about money. I want to worry about creating the best possible plan for this patient, achieving this for you, and being there to take care of it. I mean, we all want to do that same thing. That's our philosophy. So it's a kind of a pet peeve because I just at the end of the day, they know that we're a premier place. They know that it's going to be very expensive because it's a technically demanding surgery that literally takes hours and it might require other things to be tuned up, but we're going to tune it up. So I'd say that's my biggest pet peeve.
Yeah, I think that's one of my pet peeves just in general. Mostly because I don't know the answer.
Yeah.
And so I'm like, I don't know.
And same, we don't either.
I don't know.
It's like I don't know how to do surgery.
And we're there trying to make sure that, the surgical part is taken care of. That's our number one. We want to make sure that we cover all our bases, make sure you are really well informed about that. And that's why we have other team members that talk about the financials, that talk about scheduling and all of that. So I do think that really helps us be able to focus on our craft and not have to focus on the other. So I think Dr. Kortesis and I have very similar verbiage when we talk about recovery for our patients. We usually say the first 2 weeks sucks for these types of procedures. These bigger procedures, that's when most of the swelling is setting in. That's when you're stiff. That's when you're not going to be able to do things around the house as easily. And then you're still going to be a little bit tired, fatigued for that next month or so. 6 weeks, you're going to start feeling better. But most patients take 2 to 4 weeks off work from a lot of these procedures, and it depends on what you do. Me as a surgeon, I'd probably have to take 4 weeks off if I had these combined procedures.
This has been a really awesome episode. I'm going to wrap it up, but one thing I think we wanted to discuss, and it's just because I have a bunch of young ladies at home in my house, and I know becoming a female surgeon takes a lot. Becoming a female plastic surgeon takes a lot. What advice do you have for young ladies who are interested in doing something really difficult like you've done, what are some tips and things that got you through where you've gotten and help you every day?
I think having a strong support system is number one, because you always want to have somebody in your corner when you're feeling like you're not good enough or it's a hard day or something like that. I always kind of struggled with finding mentors and things in plastic surgery, but I always had a really strong support system with my friends and my family. So it doesn't necessarily have to be somebody that you look up to in that field. It obviously helps, and I would say that would have made my life easier. However, I think being able to lean on the people around you when you're going through tough times, and I mean, as you guys know, I mean, you've been through it, plastic surgery training is tough. And so being able to have people that support you through that is really important.
Thank you for tuning into this episode. This has been a great discussion on massive weight loss and massive weight loss surgery. If you have any other questions or interested in any other topics related to this, please message us directly or visit our website or our social media handles.
Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.